Chair's chair.
Well, good evening, everyone. Good evening, Minnesota. The folks in the room probably anticipating it looks a little different this time. As we come in here, we received CDC guidance, as many as you are well aware this afternoon. It's a good day. It's another one of those moves in Minnesota and across the country of a back towards normalcy. And the CDC is now recommending that if you have been fully vaccinated and beyond your time, you no longer need to wear a mask in most settings. It's exciting news. And I think first and foremost, it reflects the discipline and the commitment here in Minnesota and in many places across the country to protecting not only themselves but their neighbors. We know that masks were a critical tool in the early stages and still remain today of stopping or slowing the transmission of coronavirus. And then when we added to our arsenal vaccines, and especially at the pace we've been vaccinating, we saw earlier in this month what a big difference it made. I was just over today at River Center at one of our state mass vac sites where we were celebrating crossing over 500,000 doses given at those. And in our family, kind of a milestone, my 14-year-old went and got his vaccine after school with his friend Violet. And so we're moving in that direction. The vaccines are making a difference, and CDC now moved their guidance. Those that are fully vaccinated, and Commissioner Malcolm will talk about what this means. We're still analyzing everything that came out of this announcement. But as we've done from the beginning, we followed CDC guidance as closely as we could. We listened to our medical professionals and experts that they gave guidance so that we could make sure to communicate with Minnesotans. And so this is good news. Minnesotans, obviously, we were moving in the direction with many of our social distancing and different moves being made. Outdoors, folks can fully fill our stadiums again. And now the good news is those that are fully vaccinated can do so without wearing masks, knowing that not only are they remaining safe, they're not putting others at risk. So I'm going to make my pitch again to Minnesotans. Those of you who aren't vaccinated, now's the perfect time. Get this done. Make sure you get it done. You can go without masks then wherever you want to go. You can make sure that you and others who aren't, and please keep in mind, there are those amongst us, and especially our younger people that are not authorized to get the vaccine yet, and those that might be immunocompromised. They can't get the vaccine, and so if you're not fully vaccinated and you may be asymptomatic, we want to make sure we're protecting our neighbors again there. But the good news is that we'll be in the morning fully signing the executive orders to remove the statewide mask mandate, but there will be decisions that can be made by local businesses, by local jurisdictions, and certainly in the healthcare industry, as is relatively normal. People will continue to mask in some of those settings, but it will be highly recommended. The commissioner and MDH will clarify some of those as we look at CDC guidance, but it's a good day. It's one that we knew it was coming. It feels great that it's warm outside, and I think for many of us, getting used to again that sense of going out, getting used to being unmasked, getting used to, as they said, being around folks and see their face. And for me, it has been a challenge this year not to see folks smile, not to see emotions on people's face, and that's a big part of the return to normalcy too. So we're excited about this. I'm going to have Commissioner Malcolm is going to talk a little bit about the health side of this, and then we've got Commissioner Grove from the Department of Employment and Economic Development to talk about the impact on businesses and how some of that guidance will come down. And again, like most of you out there, we got this guidance about 5 hours ago or so, and they've been working diligently to make sure that we're able to forward the proper guidance, the proper recommendations, and understand what the impact will be. And so with that, I'd like to welcome Commissioner Malcolm.
Well, thank you, Governor. I have really mixed feelings about this. I certainly agree with the governor that there's some really good news here, and that good news is the science is getting increasingly clear about not only the effectiveness of the vaccines in preventing severe illness and hospitalizations and death, which is enormously effective at, but the data are getting clearer and clearer as well that the vaccine prevents asymptomatic illness, so makes it we're much more confident now that when we're vaccinated, we're not putting other people at risk unknowingly. So it's a good thing, and we appreciate the CDC's updating of their guidance for fully vaccinated people. And I think it's just important that folks understand what the guidance is, which, as the governor said, the guidance is that fully vaccinated people essentially are free to go back to the activities we did before the pandemic. The guidance, CDC guidance remains, and our MDH guidance will remain, that people who are not vaccinated still are at risk. And my ambivalence about this, or my concern about this, is that there's still an awful lot of people in Minnesota who are not vaccinated. We're making great progress. We're at 61% of the currently vaccine-eligible population, or I should say, amend that, the 16-plus population. But 61% is not nearly enough to keep this virus suppressed. So we do urge people who are not vaccinated, as the CDC does, to continue using all those other precautions. And to absolutely take seriously the value of vaccination and the importance of it for our community. But what I think, as we've talked before, what this now means is, even though things may not be a requirement anymore, they will remain strong health recommendations to continue to follow that CDC guidance as we learn more and more. So with that, I'll turn it to Commissioner Grove, and I'm sure you will have some questions.
Well, thanks, Governor. Thanks, Commissioner Malcolm. Good afternoon, everybody. This is a good day in Minnesota, and the past few weeks, as spring has finally arrived here, have been a great few weeks for our businesses. You're starting to see those sidewalk cafes packed again. You're seeing people go out to stores and restaurants, and spring is always that kind of time of energy in our economy in Minnesota, but to have it come this year on the heels of so many folks getting out and getting vaccinated, our numbers continuing to go down for COVID, it is a great time for our recovery, and it's something that we want to make sure continues. I've had a chance to talk to a number of business leaders today since the CDC's announcement has come out. Their issues remain the same. They want to make sure customers and employees feel safe, and that customers feel consumer confidence when they come into their businesses, and they feel like they're in a safe environment where they can engage safely in a normal way, but recognizing there's still virus out there. We know businesses without a state mandate will manage this in different ways. But I think we want to be clear that we don't expect businesses to be sort of cops at the door for customers coming in and asking for vaccine cards and having to sort of mitigate this on their own. That is a situation that will be rife with conflict. It will lead to, we think, just some impractical enforcement situations. Businesses don't want to have to be doing that. So this really is about personal responsibility. It's about individual Minnesotans who are not vaccinated following that guidance from the CDC to wear a mask if you are not vaccinated, and most importantly, to keep the pressure on to go out and get vaccinated, to go out and be vaccinated, so that soon masks at all are not necessary for Minnesotans in business settings or in any other kind of setting. Many businesses are still thinking about how to transition back into some version of normal in a thoughtful and in a way that is paced. We expect that to continue as return to work plans are in place for businesses who come in together in person and don't face customers. They're figuring out how to get that right. They want to make sure that their businesses have that kind of herd immunity within a business structure, and so vaccines will help get us there. But not having masks, I think, will help all of us continue to see that the future is looking brighter here. And when we think about a recovery and all that's necessary there, we have reason for optimism right now. Today is another milestone in that journey, but we're only going to continue to make progress if people get out there and get vaccinated, so that confidence continues. More people can get out and work and get out and spend money, and we can continue this progress of getting Minnesota to our next chapter. So with that, I'll turn it back to the Governor.
Thanks, Commissioner. And I do want to note, there's the folks that feel some anxiety around this. I think for all of us, it's that return to normal. We here in Minnesota have laid out that path. We were headed to this place based on our vaccination rates anytime between the next several weeks, and certainly we had a date certain on when the mask mandate would go. I think those recommendations, what we've seen is the vast majority of people will choose to do the right thing when they have good information, they have good guidance on there what needs to be done, and now we're at a point where we can ask people. Before this point, well, we should have just asked people to do it on their own anyway. That's very difficult when people were put and had to go back to work and were in unsafe situations. The availability of the vaccine and the uptake of Minnesotans has certainly made this easier for us. I do, though, on this day, just continue to stress with your neighbors, with others, and especially those young folks who are now eligible, get vaccinated. It's the right thing to do. These variants are still out there. We are still the 4th highest state with infection rates. That number is dropping off pretty precipitously the last several days, as we thought it would. But we still need to manage this. The good news is, between those that aren't vaccinated wearing their masks, those that aren't vaccinated going and getting their vaccine, we'll just continue to improve on this. So Minnesotans, this guidance will be out there. We'll get it up on the Minnesota Department of Health website so that you know what you can do. And again, this is being Minnesota nice, as we said all along. Help people along with this. I want to reiterate what Commissioner Grove said early on. I'm willing to make those decisions, those hard decisions about masking, because we knew and we saw where you didn't have statewide mandates, you got a lot of tension amongst folks going into businesses. You had personal businesses had to end up being the enforcer at the door. That caused a lot of confusion. So this gives us some clear guidance across the board. It lets those businesses make those decisions. And again, for consumers, this is about being confident that you go back into a business, and if you're going into a business where folks are unmasked, you know that they're vaccinated, it's a safe thing to do, and we can start returning to normal. So I'll take some questions now from folks. Yeah.
Governor, I'm sorry, just to be crystal clear, so Minnesotans are now free to follow the CDC guidance on masks, and your mask mandate is no longer?
Yeah, tomorrow it'll be official when we sign it. So we have to go through the procedures of that. The attorneys are working on that right now. They've worked through it, and I appreciate that, because Minnesotans have followed the rules. Minnesotans want to get this right. It'll be official tomorrow. I want to, as I've done, and I hope Minnesotans have seen, I want to model anything I would ask Minnesotans to do. I did myself, my family did, and I think it's modeling now. And for some of us out there, I do want to acknowledge there's going to be a little bit of anxiety re-entering a crowded space with no mask on, because you've done what was asked of you this whole time. So there's going to be some relearning on that.
Governor, you decided to go all the way right away with this. Did you decide that keeping a mask mandate in place for unvaccinated people was just going to be unworkable?
Yeah, no, it's a good question, and I might have Jan. We've been spending a lot of this portion of this afternoon having these discussions with healthcare professionals, looking at other states. I'm talking, we're talking to our peers in other states. The question being is a really tough one. Why didn't you keep the mandate on unvaccinated people? Because we get into a situation that I think is untenable. We would have got into a vaccine passport, and I know there's a validity around this argument, but it is highly politically charged. And I think we're at a point right now where we've asked all along, and now we're really asking that for people to show respect for their neighbors and the personal responsibility to get this, because we have such a large number vaccinated. But the question is well taken. It was debated for the better part of this afternoon, and I just think this, and again, just one of the things that came up was, are you disincentivizing people being vaccinated on this? I don't believe so. I think the vast majority of people do it. It's the right thing. I believe a large number of those that haven't been vaccinated, it just simply hasn't been convenient enough for them. I think these walk-ups is really interesting, especially with Gen Zers. These are not appointment people. They can't imagine that we used to say, oh, I'm going to watch TV at 8 o'clock on Sunday night when this show's on. They would never do that. Or the idea we used to order things and it would take 10 days to get them. No, I want it tomorrow. And so some of this walk-in, we're starting to see some pickup on that. But the question is well taken. Yes, we debated it a lot. I think this is one that it's just clear. I'm really asking people, if you're not vaccinated, please do it. You got a lot of your neighbors out there. And again, think of those folks who for whatever reason can't get vaccinated, or our little ones who still aren't eligible to be vaccinated.
Governor.
Go here and here.
Governor, did you know this was coming? Were you caught off guard by the CDC's announcement? We were stuck on that 70% number, and now this announcement comes.
We were moving towards it, and we're probably further along than most states. Yes, I did not expect it today, so I was caught a little bit off guard. I would notice some of you who watched the president's announcement the other day when he turned to Jeff Zients, who was in the room with him, and said, Jeff, we're going to make some moves around this. We anticipated they would be coming with more guidance around the masking, especially. And keeping in mind, CDC has no mandates. They have recommendations. We've chosen to follow the science, listen to CDC for the most part, and then adapt them to Minnesota that made best. But we didn't get a heads up. We got the announcement the same. Jan, am I speaking out of turn at the same time everyone else? Right. I'm taking that you would have rather liked a little lead time. Okay.
Governor, you're
good, but I understand. And again, it's probably fair that folks ask, can't the executive branch give more lead time for some of these decisions? We've heard that critique of us, so it's maybe appropriate that we've heard that from them.
Governor, circling back to businesses, are there specific guidelines coming, or are they on the same timeline as the general public? Offices, businesses?
Yeah, the question is around, is there a special time for business? No, this applies to the entire economy. And I just want to reiterate, we don't expect businesses to be the ones that will then enforce are you vaccinated or are you not vaccinated at the door? We know that that is fraught with challenges. Many times it's that entry-level worker at the door accepting people into a business, or sometimes there's nobody at the door at all. Businesses will figure out what they need to do, but this is really about personal responsibility if you are not vaccinated to wear a mask, not about businesses having to bear the brunt of their own of a different mandate or a mandate for their establishment.
Governor Walz. This is airlines will continue on. My anticipation is that hospital settings, potentially long-term care, they will continue to ask people to do that, which they have the right to.
Governor Walz, Devon Rahming here with KARE 11 News. A lot of people are saying that this is sort of the end of the pandemic, that the mask mandate being lifted, this would be the end to the pandemic that we've been waiting for. Is this the end to the pandemic, and how does this factor into your peacetime executive order? Yeah, well, we'll do that tomorrow, and as I've said, basically what's left is my ability to vaccinate. We knew this piece of it was coming to an end, so there's one or two of those tools that are still out, the ability to vaccinate folks, some testing in there, and the ability to move some state employees around to help us. So those peacetime emergencies are done. I mean, the business mitigations are coming to an end. I want to be clear, it's not the end of the pandemic, but it is the end of the pandemic for a lot of vaccinated folks. Now, the question is society-wise trying to get to that, and I think we've all acknowledged, and it's not necessarily a failure, it's the nature of where we're at with COVID. We probably won't reach herd immunity, but we need to manage this. And I anticipate we'll need to manage this for years to come, but we manage flu. We manage meningitis outbreaks when they come, much more manageable where you don't have the wide mitigation efforts and that local public health. I do think I'd say as this goes on and it's not the end, we need to think about the next time, and God help us and hope it's never or 100 years from now. Think about what do we do to re-strengthen public health that needs to be there, and what do we need to do on preparedness for the next pandemic. We in state government have pivoted on some of those things to make sure we will always have a strategic state stockpile rather than a strategic national stockpile. But I want to be clear, this is a good day. There's a lot of normalcy. If you and your family are vaccinated, a lot of the things are pretty much back to normal as of this move, but there's still a lot not done yet. And I think this is the fear, and I don't want to, Jan, if you want to say anything, the commissioner's deeply concerned that this gets rid of a sense of urgency. It makes it easier for people to say it's over, and there's no need to go get vaccinated. I think all of us, we maybe say something, Jan, on that, because it is a concern, and it's why we really do need to shift to that. Folks need to do this or talk to their neighbor to do it.
Thanks, Governor, and thank you for the question. That is exactly my anxiety as I stand here, is that, and we've talked about this before, I think, when things are no longer a rule or a mandate, people think, therefore, everything is safe. And people may translate this guidance as meaning that the pandemic is over, and it's just going to be incumbent on us. We appreciate your help getting that distinction out there. We still, as the governor said, we are the 4th highest state in the country for case growth. We've got a lot of people vaccinated, but as I said before, and I'll just repeat it, we don't have nearly enough people vaccinated to keep this virus suppressed. It will come back if we don't continue to build up more vaccination. So I really, and I know it's a difficult thing maybe to parse out, well, if it's no longer a rule, then aren't you saying it's safe? I think it's really incumbent, this is still so much in our hands, our individual hands, to make well-informed decisions for ourselves and our families, and to really just know that people are in different risk situations, and we really owe it to each other to know that the pandemic is not over and that we still have work to do. So thank you for asking that.
Governor, I'm curious, this takes away the tool to kind of help get the state to 70%. Will the state consider any other options to kind of get to that? Yeah. Any other encouragement? Yeah, it was one of the tools, but it's just that wasn't the the carrot, if you will, on this. It was that 70% is an important number, because that's where a lot of the epidemiologists, and again, it's not a magic number, 68, 72, but that 70 number starts to get us at least as a floor to where it's much more manageable, what the commissioner's talking about. And just, I think when the studies are done on this in the years to come, by us have been over 50%.
when this latest wave hit, I think is going to be responsible for saving a lot of lives. Now, as far as the incentives go, I was joking today, it doesn't take $1 million to get Minnesotans vaccinated, but it might help. We've explored some of those things, ask what's legal. I do think at this point in time, some of those incentives, and I don't want to diminish people of saying, really, you couldn't just go get the vaccine to help your neighbor, you couldn't just go do it because it's the right thing to do. What I hope is for Minnesotans in this is where we all work together. We don't shame people for wearing masks. We gently nudge people to go get that vaccine. We encourage them to try and do it. It is about that social compact. And the good news is now we have real world proof positive that if you get vaccinated and a large number of people get vaccinated, we don't get sick, we don't go to the hospital, and life returns as normal. That's how you beat the pandemic, and that's how it becomes just a persistent low-grade burn that we get better at with booster shots or whatever that might be. Peter.
Hey, thank you. First, I want to ask you to clarify something we heard you say, which was that the emergency powers are over. Was that a did you misspeak?
Well, for the most part, they are. We have a handful of things open. This will remove that. I have the ability to do some of the things around vaccinations. I can move some state employees around. We're trying, as we've tried for 5 months, take the eviction moratorium off there. But I think the idea of, I should say this, the business mitigations that seem to be the focus of this, because when people said emergency powers that they're really mad about, I would sometimes ask them, I said, do you think it's horrible that I've allowed restaurants to use state right-of-ways to move, out into the streets? And no. So it's a general feeling around this, but when you start taking the individual emergency orders, people are pretty supportive of them. So they're not all closed out, but as far as mitigations go, this is pretty much about it. We'll wind down here.
Okay, thank you. My question is this. You've said you're following CDC guidelines, but in fact you're not, because the CDC said today that mask mandates are not required for those who are fully vaccinated. You've got about half the state fully vaccinated, yet you're lifting the mask mandate for everyone, which is not what the CDC is recommending, the way I read it. Can you speak to that, both you and the commissioner?
Yeah, and yes, and that's right. And the CDC doesn't mandate anything. I would assume that the CDC, as what they've done, was allow the states to make some of those decisions. We have made the determination, and again, that the confusion that would be caused by this and the onus that would then be put on individual businesses would be almost untenable and unworkable. And again, while yes, it's true the entire state, the 50%, the big chunk of those now are those that are not eligible because they're younger than age 12. So the vast majority, we are approaching those, as we said, 61%. We're approaching a big chunk of the state that's done. So what we're talking about right now, as of today, those 16 and over that aren't vaccinated is about 39% of the population. Those are the folks that we're talking to. Those folks still need to continue to wear a mask. We would encourage them to get a vaccine, but I think setting up a dual-tier system, we spent a lot of the afternoon discussing this, would prove more of a challenge and less effective than appealing to what has worked in a lot of cases for Minnesota and have clear guidance. People know where they're at, and then give clear guidance on how some of those things would end. And we said all along, once we had the ability to vaccinate, once we had the ability to protect our hospital space and our most vulnerable, we would adjust accordingly. So, Jan, do you want to talk about anything on CDC?
Yeah, just to quickly reiterate, our guidance will remain the same. We will, the MDH guidance will reflect the CDC guidance, but the recommendations just don't have the force of a mandate. And I'll be completely honest with you, if we thought that it was enforceable to be able to divide people into, those vaccinated have one set of rules and those unvaccinated another, I definitely, would have liked to see that. I think it's just not practically enforceable at this stage. So, but we will continue to be clear that our guidance remains that there's a whole lot of stuff that's much safer if you are vaccinated than if you're not.
Does this change guidance at all for schools or athletics?
Because we're so close to the end of the school year, the current Safe Learning Plan guidance will stay in effect through the end of the school year.
So just so we're clear, when this mask mandate is lifted tomorrow, does this mean that local governments and cities won't be able to implement or enforce a mask mandate?
No, the local authorities do have the ability to impose restrictions above the state level if they wish. That's been a core principle for many years in public health, that local jurisdictions have the right to go higher than a state floor.
Governor, on June 14th right now, you're scheduled to have a special session about your emergency powers. So is that still going on?
Yeah, we will still ask, and we have, we have tomorrow for May 14th, and then we'll go into June. And yes, that these are, again, emergency executive powers under statute, Chapter 12 of Minnesota statutes. They have been upheld in court after court of law. Obviously, they were not popular with some folks, and Republican legislators expressed concern. Again, for all practical purposes, the concerns that they had because of the work that we've done and where the science is at, those are no longer in effect, which we told all along they would end as the virus ended and when it came time to do that. The ability to be able to vaccinate, to be able to use federal funds for supplemental nutrition programs, the $40 million a month, we want to keep those things in place, but it's incredibly limited. And I would think, I haven't heard yet, I would think that that would be acceptable for folks across the political spectrum, because it's pretty limited and they're pretty operational in terms of just managing this in a way that isn't possible through the legislative process alone.
Governor, if you were to go, say, to Target or COV.WALZ this weekend, would you still wear a mask or would you go without? I
would go without based on CDC guidance, but I would be candid with you. It was strange for me to come over today doing that. It was new because I have been, one, I believed the science, and I thought it was really important for me to model everything I was asking of others. So I have not gone into a public space without one. We've spoken here because of the distance, the plexiglass, some of that, but I would now. And the big thing for me was, like so many I think that are out there, it's not just about your own health, that there was not clear guidance from CDC that assured us that I wasn't spreading it inadvertently to someone else, and that's what I did not want to do. CDC and the science behind us is telling us that it is not doing that now, so I will do that. And more people will recognize me, and I'm sure that'll go well. So.
This is a good transition. There's a lot of information from Minnesotans today and likely tomorrow as well. Can you continue with that and share some situations where people will have to wear masks that are fully vaccinated, even with this guidance or with the lifting of the order?
We'll talk. I think, as far as we know, that airlines, federal, they talked about Amtrak and some of those things, they would keep it in place. I'm assuming, I did not, I'll guess have to look at the guidance myself, for federal buildings where the federal government said that's coming off. And then I would assume, like I said, I would anticipate that most medical settings, hospital settings, clinics and things would continue to do that. And then individual businesses will post accordingly. And I would assume that maybe that's based on risk, maybe it's based on their employers, maybe it's based that they want to just, the one thing is that if that's your policy, you wouldn't deal with then who's vaccinated and who's not. You just have everyone wear a mask. And that's the way some states took that from the beginning. I don't think that was effective. I think our numbers pan out that from infections to death to hospitalizations, that it worked better to have the mitigations in place. But there will be some of those situations. And I would just ask Minnesotans, this is, show a little grace to your neighbors. This is a good time. I remember saying, I think it's probably been over a year ago, when people were thinking about how this was going to end, and I said, it's not as if there's going to be a day when all the church bell rings and we all come out of our house. It's not exactly like that, but today is a little bit like that there's going to be folks, as you said, you can walk down through Cub Foods, as long as Cub Foods, it makes that move, and you can start to do a lot of these things that we've missed doing. So. Did I skip somebody? We got time.
Hey, Governor.
We drove folks out at night, so.
I've heard some confusion and just thoughts coming out from parents who might be vaccinated, but their kids are not. Do you have guidance for parents who are navigating that situation?
We are, myself, my son just got vaccinated today. My 20-year-old is vaccinated with us, my wife and I. He, of course, wears masks, and he'll be in a situation where he plays, or goes to school with some older kids who might already be vaccinated. Jan, you might talk about how that works. And this is one, again, I really appreciate this question, because it's one we spent a lot of time on today. We've got a lot of Minnesotans, our little ones, who can't get vaccinated yet, and their parents are worried about them getting it or what would happen. So
I think if I understood your question right, it's parents who are vaccinated who are concerned about their kids who are not yet. I think the CDC guidance today and the strength of the evidence that's been growing suggests that parents don't need to worry that they might be putting their children at risk if they don't themselves continue to mask. If they're fully vaccinated, they are not at risk of transmitting to their children. We know, and we look forward to the fact that 12 to 15-year-olds are now able to get the Pfizer vaccine. We know the other vaccines are doing, vaccine manufacturers, are in clinical trials so that more of the vaccines, we think, in coming months will be available to younger kids. And Pfizer is actually doing clinical trials in much younger kids now. But what we know for sure is that everybody 12 and up is now eligible for Pfizer, and that will expand to other vaccine types in the future.
And if we drug you out late, I'd take another one or two if there's any left. Great. All right. Thank you all. Thank you all.